What does 20/20 vision indicate? Options are A. Perfect peripheral vision, B. Normal visual acuity, C. No color blindness, D. Adequate tear production. The right answer is B. Normal visual acuity. Visual acuity is the ability to see details of an object clearly and separately at a given distance. Visual acuity is the ability to see details of an object clearly and separately at a given distance. It's a measure of how sharp your vision is. It is measured by Snellen eye chart. 20/20 is considered as visual acuity normal. 20/70 is visual impairment. 20/200 is legally blind. Let's see other two types of vision. The central vision. It enables visualization of objects directly in front of you. The peripheral vision, whereas it enables visualization of lateral objects while a person is looking forward. Which vitamin deficiency is linked to night blindness? Option A, vitamin C. Option B, vitamin A. Option C, vitamin D. Option D, vitamin E. The answer is option B, vitamin A. We need vitamin A for good vision and eye health. Apart from that, vitamin A helps you for strong immune system and for healthy skin and mucous membrane. Vitamin A is essential for producing rhodopsin. The rhodopsin, which is found in the rod cells in the retina, which is responsible for night vision. So if you lack vitamin A, it can end up in night blindness. Vitamin A rich foods. Vitamin A is a fat soluble vitamin and therefore needs to be consumed with fat to have optimal absorption. Vitamin A rich foods are eggs, milk, cheese and butter, fruits and fish, sweet potato, tropical fruits and vegetable, and cod liver oil. Which layer of the eye contains the blood vessels? Options are A. Cornea, B. Retina, C. Choroid, D. Lens. The answer is option C. Choroid. The choroid is a vascular layer that supplies oxygen and nutrients to the eye. What is the priority assessment for a patient with sudden loss of vision? Options are A. Pupil reaction, B. Pain level, C. Visual acuity, D. Family history. The answer is C. Visual acuity. Sudden loss of vision requires immediate assessment of visual acuity, which is tested by Snellen chart to identify the underlying cause. Which condition is characterized by increased intraocular pressure? Options are A. Cataract, B. Glaucoma, C. Macular degeneration, D. Retinal detachment. The correct answer is B. Glaucoma. Glaucoma is a group of eye condition that damage the optic nerve, which is often due to high intraocular pressure. In glaucoma, there can be caused by inadequate drainage of aqueous humor and which can lead to high intraocular pressure. Usual symptoms of glaucoma are peripheral vision loss, eye pain, halos around lights, etc. What is the primary nursing intervention for a patient with conjunctivitis? Options are A. Administer eye drops as prescribed. B. Apply a warm compress. C. Educate about hand hygiene. D. All of the above. The answer is D. All of the above. Conjunctivitis or pink eye, it indicates inflammation of conjunctiva, usually caused by allergy, infection, or even trauma. There are two types. It can be bacterial or viral, which is usually extremely contagious. The treatment includes medications, hygiene, and comfort measures to prevent the spread. Cataracts involve opacity in which structure? A. Cornea, B. Lens, C. Retina, D. Iris. The answer is B. Lens. Cataract is an opacity in the lens of an eye that impairs the vision. It can result from protein accumulation, causing kind of cloudiness of the lens and blurred vision. Which condition involves the central retina and leads to loss of sharp vision? Options are A. Glaucoma, B. Macular degeneration, C. Retinal detachment, D. Uveitis. The right answer is B. Macular degeneration. Macular degeneration is a condition primarily affects the macula, the area responsible for detailed vision. Macular degeneration, it affects the macula of the eye. Macula is a small area in the retina which is responsible for central vision, which is nothing but the allowing to see the fine details very clearly. So when the macular degeneration happens, how it affects your vision? You can clearly visible in the picture. The first one is normal vision. When your central vision is affected, the second picture says it all. The central vision is affected there. And talking about macular degeneration, it is the number one cause of vision loss in people, especially over the age of 60. And risk factors considered to be smoking, hypertension, and family history, and diet lacking keratin and vitamin A. These are considered to be the risk factors. What is the first action when administering eye drops? Options are A. Pull the lower lid down. B. Place drops directly on the cornea. C. Check the label and expiration date. D. Instruct the patient to blink continuously. Answer is C. Check the label and expiration date. Ensuring the medication is correct and not expired will prevent the medication error. The steps in administering eye medication. First, tilt your head back. Second is pulling the patient's lower lid down to create a pocket. Why it is necessary? The cornea, which is very sensitive and it can be injured by eye drops falling directly over it. So therefore, eye drops should be instilled into the lower conjunctival sac of the eye to avoid the risk of corneal damage. And the third step is put a drop or how much ever is necessary in the pocket without touching your eye with the bottle. And The last step, applying pressure. Close your eye and press your finger against the inside corner. Why it is necessary? Applying pressure against the nose at the inner canthus of the closed eye after administering eye drops, which can prevent the medication from entering the lacrimal duct, that is tear duct. If the medication enters, what happens to the tear duct? It can enter the nose and pharynx, where it can be absorbed and it can cause some toxic symptoms, it according to the medication that you use. And some additional tips to remember while administering the eye medication: make sure to use the eye drops or ointment as told by the healthcare provider, of course. And if you have been told to use both eye drops and eye ointment, apply the eye drops first, then you have to wait for 3 to 5 minutes, and then you can apply the eye ointment. And in the picture you can see how do you apply the eye ointment, which is from the inner canthus to outer canthus. That's how. Okay, once more, inner canthus, this is the inner canthus. From the inner canthus to outer canthus, you will just apply the eye ointment and try not to touch the tip of the dropper or tube to your eye. The dropper or the tube that has touched the eye can become contaminated. What should a nurse instruct a patient post cataract surgery? Options are A. Avoid bending or lifting heavy objects. B. Sleep without an eye shield. C. Resume all activities immediately. D. Avoid all light exposure. The answer is A. Avoid bending or lifting heavy objects. Bending and lifting can increase intraocular pressure, delaying the healing process. Let's see some post-cataract surgery things. Post-op position, usually the nurse should instruct the client to remain in semi-Fowler's position or on the non-operative side. Non-operative side. And next thing is the changes in vision after the cataract surgery are not immediate. It will take some time, and you have to instruct the client to be patient while adjusting to the changes. Using an eye shield at night can prevent rubbing the eye, and the client does not need to stay out of the sun but should wear dark glasses to prevent discomfort from photophobia. And very importantly, sudden sharp pain after eye surgery should suggest to the nurse that the client may be experiencing intraocular hemorrhage. So the physician should be notified very promptly. Vomiting after the surgery can increase the intraocular pressure, and which should be avoided after eye surgery, and it can end up in some of the complication. So these are the points have to be remembered after cataract surgery. Which symptom suggests retinal detachment? Options are A. Floaters and flashes of light. B. Gradual loss of peripheral vision. C. Pain in the eye. D. Redness and swelling. The answer is A. Floaters and flashes of light. Retinal detachment often presents with floaters, flashes, and a curtain-like shadow, which is other symptom of retinal detachment. Retinal detachment. It is the separation of the retina from the underlying tissue. If it is untreated, the partial detachment can become complete and the blindness occurs. What are the manifestations of retinal detachment? The flashes of light.
and floaters or black spots, usually the signs of bleeding. And there is shadow inside vision. It is nothing but a shade or curtain coming across the vision of your one eye. Then some gray curtain appearance is another signs and symptom of the retinal detachment. So what you have to do if you find bed rest, providing bed rest is very important, covering the both eye with patches as prescribed, and speak to the client before approaching them. Positioning the head as prescribed is very important, and protecting the client from injury, and avoid jerky head movement, and minimize eye stress, and prepare the client for a surgical procedure as prescribed, which is also very necessary, which is usually a scleral buckling. What is the priority for chemical exposure to the eye? Options are A. Administer antibiotics. B. Rinse the eye with copious water. C. Apply an eye patch. D. Notify the physician immediately. The right answer is B. Rinse the eye with copious amount of water. Flushing the eye is the immediate intervention to remove the irritant and prevent further damage. Eye irrigation. For accidental eye exposure to body fluids, for example blood or urine, or exposure to any chemicals, immediately flush the affected eye with water or saline for at least 10 minutes, and definitely it depends on the what kind of chemicals you have exposed. Then where to wear, it is very important. It is from the inner canthus to the outer canthus. So by doing this, you will reduce the exposure to potentially infected material and prevent or reduce injury to the unexposed eye or the other eye. Any eye injuries should be seen in the emergency department.
What is the recommended technique for administering eye drops? Options are A. Drop medication directly onto the pupil. B. Instill drops into the outer corner of the eye. C. Place drops into the conjunctival sac. D. Apply drops to the lower lid margin. The answer is C. Place drops into the conjunctival sac. The conjunctival sac ensures proper absorption and minimize comfort. Which action should the nurse take after administering eye drops? Options A. Encourage the patient to blink rapidly. B. Apply pressure to the nasolacrimal duct. C. Wipe the eye with a tissue immediately. D. Instruct the patient to keep the eye closed for 10 minutes. Answer is B. Apply pressure to the nasolacrimal duct. You can see here applying the pressure. Why? This will prevent the systemic absorption of the medication via the nasolacrimal duct. How should a nurse assist a visually impaired patient during ambulation? Options are A. Hold the patient's arm. B. Allow the patient to hold the nurse's arm. C. Use a wheelchair. D. Guide the patient using verbal cues only. The answer is B. Allow the patient to hold the nurse's arm. This technique is known as sighted guide technique, which involve The nurse walking 1 or 2 steps ahead of the patient while the patient holds the nurse's elbow. This technique helps to provide support, safety, and guidance while still allow the patient to maintain their independence and they will feel more secure. How should the nurse assess extraocular muscle function? A. Perform a Snellen test. B. Use the cover uncover test. C. Perform the 6 cardinal positions of gaze test. D. Use a pen light to check pupil response. Answer is C. Perform the 6 cardinal position of gaze test. The test evaluates the strength and function of the eye muscles. What is the role of rods in the retina? A. Detect light in dim conditions. B. Distinguish colors. C. Provide central vision. D. Focus images on the retina. Answer A. Detect light in dim conditions. Rods are a type of photoreceptor cell in the retina. They are sensitive to light level and helps to give us good vision in the low light, but do not detect any color. Which photoreceptor is responsible for color vision? A. Rods. B. Cones. C. Ganglion cells. D. Bipolar cells. Answer is B. Cones. Cones detect color and function best in bright light. To remember always cone, C, color.
If you find the video useful, please like, share with your nursing friends, and don't forget to subscribe my channel Nursing Exam Insight, your ultimate resource for all nursing exams. Thank you.